Welcome back to Have More Babies. We're the show that digs into complex sources so you don't have to, giving you what you need to be truly well-informed. So today, we're going deep into the world of pediatric medicine. We often just think, pediatrician, okay, kids doctor. But the stuff we looked at, it shows a role that's, well, much deeper, way more specialized, and really focused on the whole child's health journey. Right, so let's unpack this. Our mission today isn't just the simple definition. We want to get into the intense training, the specific knowledge they need, and really understand how comprehensive their role is in a child's well-being. And this covers like birth all the way up to age 21, right?
Exactly. That age limit, up to 21, is really the first big thing to grasp. A pediatrician is a medical doctor, yes, but they're trained specifically for the unique changes, physical, mental, emotional, that happen as kids grow. So newborns, children, teenagers, even young adults, it's not just, a little bit of general medicine. It's its own dedicated field.
And it's fascinating how broad that field actually is. It's not just, like you said, fixing a broken arm or dealing with a cough. They're primary care physicians managing the whole patient. Physically, mentally, emotionally, it's all connected. And the sources pointed out this holistic idea. It's not some new trend, is it? It lines up with the World Health Organization's definition from way back.
That's right, since 1984, actually.
Wow.
And that consistency really tells you something about how essential this specific focus is. If you look at what they're actually trying to achieve, their main goals, there are basically four big ones. The first, historically, is a huge one, reducing infant and child mortality rates.
Okay, fundamental.
Absolutely. But then it goes way beyond just survival. The second goal is all about education, teaching families about health, about illness, promoting healthy habits based on, solid science. Third, they often act as advocates for kids, for their rights, for access to education. And fourth, they really champion modern health interventions. Think basic hygiene and, crucially, immunizations, making sure those happen on schedule to prevent diseases.
That's a lot of ground to cover: advocacy, education, prevention, plus treating sickness. How does one doctor manage all that, especially since kids are changing so fast, physically and mentally?
Well, that complexity is precisely why this specialization is so vital. You hit the nail on the head. A toddler's body handles medicine differently than a teenager's. Their brains are developing at different speeds. They react to things differently. Pediatricians need that deep, focused understanding of these nonstop changes. And yeah, that definitely shapes their training. It has to.
Right, that makes sense. So they have this unique, broad mandate. Where does that deep expertise actually come from?
The journey to get board certified sounds incredibly demanding. First, there's the MD part, like 6 to 8 years for undergrad and med school combined.
Standard medical training, yeah.
But then the real pediatric focus comes during the residency, right? 3 years. Yeah. 3 years of dedicated pediatric residency training, yes. Yeah. And it has to be through programs recognized by the ACGME, that's the Accreditation Council for Graduate Medical Education. It ensures everyone meets a high, consistent standard.
Okay.
And here's a stat that really jumps out from the sources. During that residency, those doctors in training have to log somewhere between 12,000 and 14,000 hours of direct patient care.
12 to 14,000 hours.
1,000, yeah.
Wow. That's an incredible amount of hands-on experience.
It really is. Think about the exposure that gives them. Before they even practice independently, they've seen just about everything, common stuff, rare conditions, across every single age group from preemies to, angsty teens. It's total immersion in child physiology and development.
And it doesn't stop there, does it? The field changes so fast.
Absolutely not. Continuing education is huge in pediatrics. Medical science, especially around things like genetics or behavioral health, it moves incredibly quickly. So pediatricians are constantly at conferences, doing training, self-assessments. They have to stay current with the latest, safest ways to care for kids.
And all that training leads to one of their key roles, something the sources called the first to notice. Because they build this long-term relationship with the child and the family, they can spot subtle things, right? Deviations from what's typical that maybe another doctor less focused on kids might miss.
Exactly. Building that trust, that communication channel is key. It lets parents feel comfortable bringing up concerns, maybe about temperament or behavior, not just fevers.
It's not just about checking height and weight charts then.
Not at all. I mean, yes, they track physical growth, looking for things like scoliosis or other potential issues. But increasingly, it's also about monitoring for developmental or behavioral flags, things like anxiety or depression, which can look really different in kids compared to adults, or ADHD, autism, learning difficulties.
Things that need early intervention.
Precisely. Even things that cause families a lot of stress, like persistent bedwetting or really intense temper tantrums, those fall under their scope for diagnosis and management.
It makes sense then, with all this complexity, that even within pediatrics, you see further specialization, subspecialties.
Yeah, the field has become so complex that general pediatrics has branched out. It ensures that if a child has a very specific or chronic condition, they get care from someone who focuses only on that.
Could you give some examples?
Sure, so you have neonatologists. They are the experts purely for newborns, especially up to the first month of life. They're the ones managing the very fragile premature babies, often in the NICU, the neonatal intensive care unit.
Okay, super specialized.
Extremely. Then you have, say, developmental behavioral pediatricians.
Focusing on the learning and behavior side.
Exactly. Things like ADHD, autism spectrum disorder, dyslexia, even issues like kids avoiding school. They help develop tailored strategies for learning and coping. And then for children who are critically or chronically ill, needing constant monitoring or life support, there are pediatric intensivists. They work in the PICU, the Pediatric Intensive Care Unit, providing that highest level of acute care.
Okay, so switching gears a bit to the everyday services, one really vital role is helping parents track those developmental milestones, isn't it?
Absolutely essential.
Yeah.
You know, the big ones, crawling, walking, first words, how they interact socially.
Parents watch for these things, but the pediatrician does the formal screening.
Right. They use standardized screening tools during checkups. This is so crucial for catching potential delays early. If something seems off, the pediatrician starts the ball rolling for evaluation and gets a specialized treatment plan going. Early intervention makes a huge difference.
And beyond milestones, the range of conditions they treat day to day is just huge.
Oh, yeah. Everything from the really common stuff, respiratory infections like bronchitis or pneumonia, ear infections, skin problems like eczema or acne in teens, to managing chronic conditions like asthma or diabetes, and increasingly initiating conversations about mental health concerns, which unfortunately are becoming more common in younger people.
So tying this all together for the listener, why should you care about all this specialization? It really hammers home the importance of those regular checkups, doesn't it?
It really does. Those routine visits aren't just for shots, though those are critical. They are the foundation for everything else. Tracking growth accurately, catching problems when they're small and manageable, providing that essential preventative care like immunizations, it all happens during those regular checkups. They build the health baseline for a child's entire life.
And good pediatric practices often go beyond just the exam room now, offering more support for families.
That's right. The sources highlighted how some practices offer a really comprehensive set of services, things like lactation support for new moms, which is so important.
Yeah, definitely.
Or having essential after-hours care available, because kids don't just get sick during office hours. Even specialized procedures done conveniently and safely outside the hospital, like newborn circumcision or medical ear piercings, it shows a commitment to the whole family's needs.
And accessibility seems key too, making sure families can actually get this care.
Supporting a wide range of insurance plans, focusing on being available when and where families need them, sometimes called a 3D model of access, especially for communities spread across different towns or suburbs.
Okay, one last key point before we wrap up, the difference between a pediatrician and a family physician. This confuses people sometimes, right? Because both can treat kids.
It does come up a lot, and both are absolutely qualified physicians. The main difference lies in the scope and focus of their training.
So the pediatrician specializes only in kids, basically, infancy through age 21.
Correct. Their training is intensely focused on child growth, development, childhood diseases, how medications affect growing bodies, all those unique aspects of pediatric health.
Whereas a family doctor.
A family doctor is trained much more broadly. They treat patients of all ages, from babies to grandparents. Their training includes internal medicine, some gynecology, adult care, and pediatrics.
So it's still competent with kids, but maybe not the same depth of focus as someone who only sees children.
Generally, yes. The pediatrician has that deeper, specialized knowledge specifically about the rapid physiological and developmental changes in children and adolescents. Choosing between them really depends on a family's needs, but for that focused expertise on childhood stages, the pediatrician offers that specialization.
That really clarifies it. So, wrapping up our deep dive today, it's clear that the pediatrician is so much more than just a kid's doctor.
Absolutely. They're highly trained specialists, crucial partners for parents, guiding them through the entire journey of raising a healthy child. They really are specialists in growth and change itself.
So what's the takeaway here? Think about those intense training hours, 12,000 to 14,000, and the constant need for ongoing learning and specialization. It really reflects how complex medicine, and especially child health, is becoming. It makes you wonder, what will the pediatrician of the future look like? Probably even more specialized. Now, if you need to learn more about comprehensive pediatric services, things like acute care, preventative checkups, lactation support, after-hours options, all that specialized care we discussed, your essential resource is omegapediatrics.com. Really, head over there for details. That's megapediatrics.com.
And hey, if this conversation helped you understand the pediatrician's role better, please do us a favor. Like this video, subscribe to our channel so you don't miss future deep dives, and share this video, especially with anyone you know who's expecting or maybe just wants to understand their child's healthcare options a bit more deeply.
Thanks for joining us on Have More Babies.
Good enough for now.